Well, good afternoon, everybody, and welcome to our very latest community training seminar webinar. And it's good to have another opportunity to talk about ClinicTracker and how to get it so that you make the most of the program. It does have a remarkable amount of features to it, and the more I think we can bring topics before you and talk about questions you've got, the better it is for everybody. We're going to run this the way we do all of these webinars, in that we have a topic to begin with that's about progress notes, and we'll go through that. Alicia is here, of course, and we'll go through the agenda that you can see on your screen now. And you can ask any questions you want about it. You do that through the system here, the GoToWebinar system, where you can type the question and we can see that you're asking it. And then after, we just open things up and you can inquire about anything you want to your heart's content, and we'll handle it there. As always, this is being recorded, so if you wanted to go back through it or have other people listen to it who weren't able to attend today, that's fine. And don't forget, while you're listening, if you see things that Alicia is clicking through and you think, boy, that would be a good webinar to do, please jot it down, let us know. The more we can have topics that meet your particular needs and address the things on your mind, the better it is for everybody. Okay, so Alicia, how you doing? Ready to talk about progress notes?
I'm ready to go.
So we're going to talk about how to record them, locking them, unlocking them, deciding things. You know, progress notes, as everybody knows, is kind of the bread and butter documentation, and really the part of the program that staff have most connection with because they got to do them. It's also the part of the clinic process and workflow that regulators are most likely to pay attention and cause harm if they're not done and signed, etc. So, you know, there's a reason why ClinicTracker has such a sophisticated way of putting in templates for progress notes and protecting them and locking them and having supervisors sign them, etc., because they are so essential to appropriate compliance. With that, what do you want to talk about, Alicia? First.
Okay, so today we're going to talk about how to record a progress note. So we'll walk through the basic process of getting into your patient contact record and attaching a progress note, just using the tools available to you, some time-saving techniques. We'll talk about locking a progress note, and just so anybody that doesn't know, when we talk about locking an item in ClinicTracker, that means that nobody can come behind you and make changes to that item. So once an item is locked, it's essentially closed for editing. Only users with special permissions can edit a locked record. So a locked progress note can only be edited by those with certain permission levels. And then we're going to talk about missing progress note reports. So as Michael mentioned, progress notes are very important to your documentation and your client record. So we're going to take a look at how you as the clinician can tell if you're missing a progress note on a particular patient contact record or if it's not complete. And then we'll look at how administrators can look at that same information at a global level. Okay. So to get started, we're going to switch over to the ClinicTracker view, and we're right here at the ClinicTracker main screen. Before we even get into where a progress note is recorded, I just want to talk about some permissions. Okay, so permissions for each staff member are set on the staff info record. I'm getting there by going to staff and then staff info. Once I'm in the staff info record, I can access a specific clinician by clicking the binocular button there, and then I'm just going to choose Janie Allen for our example. So this is the clinician I'm going to look at. I know she's a clinician because I see that here in the staff type where it says supervisory and clinical. Right? To set her permissions, I'm going to go to user responsibility. Now here at the top of the user responsibilities tab, you'll see that this user has access to both the mental health and chemical dependency module. That means that she's going to be able to do paperwork and progress notes for either chemical dependency or mental health. Okay. Here we see two settings that pertain to signatures, okay, and these signature settings apply to the progress notes as well as the paperwork items. So where it says always require supervisor signature, if this option is set for either module, what's going to happen is the system is not going to allow this user to lock the progress note or paperwork item until a supervisor signature is applied. So that's helpful if you have interns that always require those supervisor signatures. You also have an option for never require supervisor signature. So in this case, if this user is if this user is a supervisor, or he or she is a reviewer and never ever needs one of those supervisor signatures, we can enable these options to prevent the system from ever asking her. That means that it's the item she's working on, or the progress note or paperwork item, is automatically going to be locked when this user applies their signature. Okay, with neither of these options set, so right now the way this looks is she has neither of these options set. That means the system is going to ask. So when the user goes to apply her signature to the progress note, the system is going to say, will this item require a supervisor signature? If she says yes, then she'll be able to go forward with the signature request process. If she says no, the item will then be locked. Okay. There's also down here ClinicTracker Access. The one specific to progress notes you're going to see is right here. So if this option is not checked, the user won't have access to the progress notes. Okay, and then of course you have edit locked records down here in the bottom. Any questions on setting the permissions pertaining to progress notes before I move on from this screen? Okay, I'm not seeing any hands, but if... Sorry.
Well, of course, as you mentioned, the ability to differentiate who can get into what applies not only to progress notes but to so many other aspects of the system, and is why ClinicTracker gives so much control to administrators, so that only people who should do things can do them, and see data should be able to see them.
Right. Yeah, and there's a number of, like you said, there's a number of settings that we can adjust in here based on the user's roles. So if you ever have questions on those, you can certainly reach out to us or go ahead and ask them at the end of the webinar. Because I'm not seeing any hands, I'm going to go ahead and move on. And we're going to pull up a patient contact record. I'm going to get into the patient contact record right through my patients widget, just because I personally find this the easiest way to move around the system. I'm going to right click on my patient's name, click on navigation, and then go to patient contacts. Okay. All of the progress notes are attached to a patient contact record. So you'll see here what I'm going to do is just copy a previously entered note by using this copy button, and I have things in here like the service, the clinician. If I have a supervisor on here, and I'm going to change this clinician to Janie Allen because we just looked at her staff info record. If I have a supervisor on here, I'm going to select the name here, so we'll say that Bill is her supervisor. Okay, once all this information is saved, I'm going to go ahead and we're just going through the prompts that come up with the patient contact record, and we're just going to kind of move through those. One thing I want to note before I even open up a progress note is that this diagnosis assignment here is locked. Okay, it's very important that you have a locked diagnosis assignment attached to your patient contact record when you want to lock your progress note. The system will not let you lock a progress note if you have an unlocked diagnosis assignment. And that's because, again, we don't want anybody to come behind you and make changes to a record with your signature on it. So if you have an unlocked diagnosis assignment and then we're able to lock a progress note, somebody could potentially edit that diagnosis assignment. That's why we don't let you lock the progress note with an unlocked diagnosis assignment. Does that make sense, Michael?
Yeah, it
Okay.
does. Yeah.
Okay, so we're going to go ahead and press the progress note button, and you'll see here there's a number of templates enabled on my system. So your list may look a little bit different depending on what your administrators have enabled for you. So for our example, we're just going to choose the standard template. The system's asking me if I want to load from a previously entered record. Okay, so the system will allow you to pull up a blank progress note, or it will allow you to copy and paste a previously recorded progress note. So for our example, I'm going to say I want to choose a previously entered progress note. And again, this is just basically copying and pasting that old progress note. So any information that had been entered previously would be pulled forward into this template that you're seeing here. So here I can move through the template, and each progress note template is a bit different. So you can take a look at what will work best for you and your users. But some shortcuts that I wanted to talk about when you're using or doing your data entry. The first one is the F2 common phrases feature. So here in this text box, and really any text box throughout ClinicTracker, whether it be on a progress note or paperwork item, this allows you to press the F2 button and pull up a common phrases list. Now, my common phrases list has some kind of test information in here, and you can see that a lot of them have been tagged with the area of the system where I use these phrases. Okay, you can have global common phrases or personal common phrases. So personal common phrases are specific to me, the user. Global common phrases are entered by your administrator through the maintenance menu. So if you have some clinic approved verbiage that you use on your progress notes or in specific areas, they'd be entered in here for you. Okay. In our case, I'm just going to sort this tag list so that I can pull up all the or get right to the progress note items, and I'm going to use this sample phrase. Then I'm going to use the test entry and say select and close, and you can see both of those items were entered in here for me. So that's a quick way I can enter blocks of text into my progress note if it's something I say fairly often. Now,
So there's two ways to make this efficient, Alicia, and one of the reasons why we did it is because staff just loved it. They loved the ability to bring in an old progress note and also the ability to have stock phrases so you didn't have to retype ones that weren't in that old progress note. Of course, administratively, you have to make some decisions about how to make sure that the progress notes aren't too canned. Because some of the regulators have issues with that. But from an efficiency point of view, this is something that really saves a huge amount of time.
All very good points. And then another time-saving feature that you can use or tool that you can use is if you use dictation software, the Windows or the built-in Windows dictation software will work in ClinicTracker, and DragonSpeak is in use in several clinics. So just moving right along here, you can just toggle from tab to tab. Again, you can use F2 in any of these text boxes that you see throughout the system. I'm going to move right down to the treatment planning tab. The treatment planning tab allows you to select your goals and objectives from these drop-down lists. Now, again, we have another F2 tool here where I can pull up a search list. So this gives me the full list of available options in that drop-down, and I can search for the item that I'm looking for. So if I'm looking for a goal with the word resolve, I can just start typing and it narrows the list for me. That's helpful if you have a super long list of goals and you have a hard time kind of sifting through them, or you're looking for a specific entry. Again, it's F2 in any drop-down throughout ClinicTracker. So this treatment planning tab allows you to enter the goal and objective that you're working on the fly, or you can pick from the treatment plan. Now, there's even options in the system that will prevent you from entering in goals and objectives directly here that aren't coming from the treatment plan. So that's something you can set at the administrative level. So for our example, we're just going to pull this active goal in from this patient's treatment plan. So, and then we'll say that there is some improvement. We can make notes here and move on. And if we had worked on multiple goals, we could do the same thing. Okay. Enter our notes in here, and then we'll go to our meds tab. Okay. This is where you can do your med reconciliation. If you're using e-prescribing or you're recording medications in the patient summary, you can use the import med history button here at the bottom, and you can pull in prescriptions prescribed within this many days. So the default is 60. If I wanted to go back a year, I could just adjust the date and refresh. Any newly added medications would show in this list, and I'd be able to import them into my note. Right? Or I can just type in manually, and then I can say a med reconciliation was performed, and that's going to be used for reporting purposes to see how many med reconciliations you're doing, and there's percentages available, and it even ties into your MU module if you're using meaningful use. Okay. On any of the templates that you're using, you'll just work through all of the tabs. If you have psychotherapy notes, you can enter them here. When you're done, you'll go ahead and sign at the bottom. The way that you sign is by having your name selected here. You'll click the sign button, and then you'll enter your ClinicTracker password here. Okay. Once your signature is entered, the document's going to be locked. So for our example, I'm going to cheat a little bit and say that no signature is needed because I'm logged in as an administrator, and I'm going to go ahead and sign. You'll see that I have automatic spell checking enabled, and now the system's just prompting me to say that the record's being locked. Okay, so now you see that this record is locked. When I close out of the progress note, I now see a locked record menu on the patient contact form. Okay, as an administrator, I have access to unlock the progress note. Excuse me. Before I go ahead and unlock the progress note, I want to take a look at what this item looks like on Janie Allen's appointments widget. So to do that, I'm just going to toggle over to Janie Allen's login. While I'm doing that, if you have questions, go ahead and post your questions now while I'm switching logins.
Somebody's got to have a question, no?
Okay. Well, now you can see that I'm logged in as Janie Allen. And right here is her patient, my appointments widget here at the bottom. Now this is showing the patient contact that we recorded with her name listed as the clinician. You can see that the status has showed up, and I see that the progress note status is locked. Okay. So as a clinician, you're going to want to just look at this My Appointments widget, and I'm going to pull this back a little ways so that we can see if she has other appointments on her widget. So I'm just adjusting the date range and refreshing. Okay, so she has a number of patient contact records in here, and you can see that there's missing and unlocked records in here. I can sort my list, or excuse me, filter my list here by looking for just missing progress notes. So this is going to show me all of my patient contact records within this date range that have missing progress notes, and that's going to give me a list of kind of action items that I need to take care of. Okay, unlocked items are where a progress note has been entered and maybe it's waiting for a supervisor signature or I just haven't signed it yet. Okay, so just coming back here, I'm double clicking that patient contact record, and that's going to allow us to open it up, provided of course that we have the correct patient access permissions. And what we're going to do is we're going to take a look at how to edit that locked record. So that progress note has been locked, and perhaps the clinician comes to the supervisor and says, I need to make a change. I forgot to enter a piece of information. What do I do now? So we're going to again use our My Patients widget to open up. So I'm right-clicking the patient's name, going to navigation, and clicking patient contacts. I'm going to double-click this patient contact record, and again, I have the locked records item here. Okay, so I'm going to click where it says locked record, and you'll see that there's two options here: unlock locked progress note or delete locked progress note. So if the clinician comes to you as the administrator and says, I need to make a change to the progress note, I'm just going to unlock it. That's going to remove the clinician's signature, and then the clinician will be able to go in there and make a change and relock it later. Okay, I see that we have a question.
We do.
Okay.
Let's see. Where's Alicia, I'm sorry. Hold on just a second. Here we go. When you set up a supervisor's signatures required, does the supervisor automatically get notified to sign a document?
No, that's a good question. The answer is no. That because the system doesn't know when the clinician is ready to forward a piece of paperwork or progress note to a supervisor, we don't automatically send that signature request. We allow the clinician to do that on their level. So I'm actually going to go over to the options form and see which template has supervisor signatures enabled. Okay. To do that, I'm going to help about. Anybody with administrative rights will be able to do this. Go to Admin Config, Options. Then here on the Formats tab, here's all the progress note templates I have available. Okay, and then you'll see in this column where it says display supervisor signature, only my DAP note has a supervisor signature enabled. So that's the one we'll use as our next example. So I'm just going back into the patient contact record, and I'll create a new one again just by copying that old one we had. And then I'm going to click progress note, and this time I'm selecting the DAP note. And we'll use a blank record this time. Okay, so I can just move through here and get to the signatures on the DAP note at the very last tab. And again, I'm just going to kind of cheat a little bit, and we'll sign Janie Allen's name. And then what Janie's going to want to do is save this record. And then she'll use this signature or the paperwork notification button here. It looks like a little envelope. And it's going to give me two options, clinician to supervisor or supervisor to clinician. In this case, I want to send this to my supervisor. And you'll see that automatically the supervisor's name appears here. And then a link back to this document appears in the body of the message. So Bill will get this message, be able to click here, go in and sign the document.
All right, so you're saying that it doesn't automatically require the signature, but it's easy just to go up there and go through the messaging system to request the signature.
It doesn't automatically send the signature notification, correct. That being said, just coming back over here to the My Appointments widget, the My Appointments widget has the option to look at the items where you're the supervisor. So even if your clinician forgot to send the paperwork notification, you can see I'm listed as a supervisor and the progress note is currently unlocked. That would at least give me the ability to follow up with my clinician to see if they needed me to sign that document.
Okay, and just to remind people, how would somebody get into the messaging system for requesting a signature other than what you showed us through the contact form or through this pane?
Well, the signature notifications that you get will show here on your My Messages widget under the SN option. You can also access your full message board if you have a list of signature notifications signature requests. You're going to see them listed out here. And they'll be in that portion of your message board. If you instead need to send, maybe you have a question, you're not ready for a signature, you can send your supervisor a message by clicking this Compose Message button, selecting your supervisor's name. You would just enter, whatever your question is. And then you can type in the body of your message and include a form link. The form link allows you to manually enter that link we just saw in the signature request. So I would select the patient, in this case John Zippy, and then I could select the document I'm looking at, and that's going to give my supervisor a link back to the item I need their assistance with.
Cool. We have another question.
Sure.
When unlocking a progress note, a message comes up asking if you are okay with the action being logged. What exactly does that mean? I didn't see that in the examples you showed.
When you unlock a progress note?
No, Amy is saying that sometimes it asks about an action being logged. Is that when there's how do you put that? That it accounts for unlocking a record and makes it be known that signature was removed, something changed, and then put back in again?
Yep.
That there's an audit trail for that?
It's an audit log. Yep, that's exactly what it does. So let's, for example, edit this locked record. The reason you didn't see the prompt is because I didn't enter my password. So in this case, let's say I forgot to put in my authorization code. Now it's asking me, why did I make a change? So this is where I would enter my reason for making a change. Then I see the audit log here. So there is an ongoing list of changes that have been made to the document since it's been locked.
I guess just for people who aren't into this aspect of the documentation, that came about because regulators came from the Office of Mental Health and said, well, once it's locked, if you get into it, you could have, patient is not at risk for suicide, something unfortunate happens, and then you go back in and say, well, patient is at great risk for suicide. How can we make sure that we can audit that and see if that's been changed? And that's how that came to be.
Any other questions before I go on? Okay, so the last item that I want to take a look at is how an administrator or clinic supervisor can take a look at all of the missing or unsigned progress notes in the clinic. So for that example, we'll go to reports, and we're going to go to admin, and we're just going to type in missing. Okay, as soon as I start typing in missing, I see this compliance missing unsigned progress note reports. It comes right to the top. So I'm going to double click here, and this is where I can adjust my date range. So maybe I want to look for the current month. You can see I can look at a specific patient group or look by all. I can change my grouping so it shows by staff or by patient. And I can look at active, discharge, or both. And you'll notice here I can filter this out to only kept appointments. Okay, so this report is going to show me a global list of all of the missing or unsigned progress notes throughout the clinic, and then I can go and follow up with the appropriate clinicians. You'll notice here on the report, it's even showing me, is the item signed by the clinician, is it signed by the supervisor? So I know exactly where I am in kind of the process of getting that progress note locked.
We used to have to hire 3 secretaries to come in on weekends before a site visit to do what we could then do with a press of a button. So that's a great report. We have another question, Alicia.
Okay.
How do we see the audit log for a particular time period and the reasons in which the notes were audited?
So if you wanted to look at a specific audit log, you would go to that patient contact record. So I'm just going back in here, and we'll see now there's this view audit log, and that's going to pull up the audit log here, and you can take a look at it.
Okay. Got another question. Is there a way to require all attended appointments to require a progress note? Can you force a progress note before somebody moves on?
Well, that's a good question. So technically speaking, a progress note is almost always required, but in order to send for billing, there's a setting on the billing side of things that allows you to always require a progress note before you can actually bill for the contact record. So that's under billing tracker and under settings and then options. There's this progress note requirement upon transition. Now, just another little vocabulary lesson. Transition means the process of taking the appointment records from ClinicTracker and using that information to create claims in billing tracker. So again, that's transition. So this is saying when I look at the appointments in ClinicTracker, am I allowed to transition or create claims for appointments where there's no progress note? So the requirement where it says none, that means it will transition anything whether there's a progress note or not. There's a warn setting, meaning that the system is going to say, are you sure you want to transition this appointment because the progress note is unlocked or missing? And then there's block. And that means if there's no progress note or the progress note is not locked, you're not going to be able to transition that appointment until that progress note is complete. Okay, so that's how we kind of meet that need. Now, there are certain circumstances where you want to block all missing progress notes except for one specific service, for example. So maybe you have a service you provide that is the one and only or one of few services that don't require a progress note. You can omit that progress note requirement for this specific service by going to Utilities, Maintenance, and then under the Service Input record. So if I had entered this service, I have the option to say don't require progress note. So that's going to allow these appointments to be transitioned to billing tracker with a missing or unlocked progress note.
Tracy is getting back still to the other side of it, to requiring the progress note.
Okay.
So if you don't have billing tracker, is there a way to force a signature on a progress note?
Well, to force a signature, no, because you're going to need to be able to allow the clinicians to record their progress notes and then perhaps go back to it later. So you're not going to want to require them to sign it at the time that they're entering information, because it might be something that they have to work on in chunks.
Right, that makes sense. It makes sense that you got to give them a chance to close and get back to it without necessarily signing it first.
Yeah, and that's why you use these reporting tools like the My Appointments widget and the reports for the administrators to make sure that things do eventually get signed and locked. But like you said, you got to give them the opportunity to do that, especially with clinicians being so busy and these days. And then, of course, you know, you have the billing requirements that it's going to kind of be the last line of defense to make sure that those progress notes are signed before they go out for billing.
Yeah, if you have billing tracker.
Yep.
Okay. Yeah. Well, so the answer really, as you're saying, is that that's more something that's a compliance check that as opposed to something that practically can be forced to have for a particular clinician. Cool. Any other questions? I guess not. Well, listen, this has been great. I want to thank you, of course, Alicia, for another great presentation. Remember, everybody, that there is the recording. Please don't forget to complete the surveys and give us ideas for future webinars. The next webinar is the 23rd of May at 12:15. It's on a very cool aspect and useful aspect of ClinicTracker, which is really our unified messaging system, using the program itself and various routes for people working on a case, whether that's clinicians working together or people involved in billing or compliance, to communicate effectively and easily. And so you'll hear about our clinic chat, you'll hear about posting messages one to another or for the entire group. And so that's 12:15 on the 23rd, and you'll also hear then about direct secure messaging, which is now the way to use the patient portal and send messages from provider to provider or from patient to provider in a way that fits a particularly secure protocol. Anything else, Alicia, or did we cover it?
I think we covered everything for today. Like Michael said, if you have suggestions for future webinars, I really encourage you to submit those with your webinar surveys. We want to make sure that we're giving you the tools you need so that you're successful in your use of ClinicTracker.
Good, excellent, thanks.
All right, thank you, everybody.
Everybody, bye-bye.